I'm Michelle Nesky, the Posh PA. So what does a PA actually do? That's a question that I tend to get a lot because PAs have been around since the late 1970s, not like nurses and doctors who have been around for a long time. So it's really important to break down what PAs are actually able to do. With that being said, the extent of how we can practice is somewhat determined by state law, scope of practice, practice setting, and our collaborating physicians. With that being said, there are commonalities that all PAs can do, and I'm going to talk to you about them right now. But before I do that, smash that subscribe button because I am here every week dropping tips on how to get you into PA school, become a successful student, and a fulfilled practicing PA. Okay, so let's talk about the clinical duties of a PA. So as a PA, I often see patients either independently or collaboratively with my supervising physician, and I am able to take histories, so ask a patient why they're there, obtain their past medical information, surgical information, their medications, go through those medications, and see what their issue is and what their diagnosis might be based on performing a history and a physical exam. So all PAs can take histories from patients and perform physical exams. I'm also able to order diagnostic tests based on what I feel might be the right diagnosis for the patient. So I can order CT scans, x-rays, laboratory evaluations. I'm also able to interpret those results. Okay, so for the tests that I order, I am able to look at the results and determine whether or not they're abnormal, put together the puzzle of what the patient's diagnosis might be. I'm then also able to explain the diagnosis to the patient and offer them treatment options for their diagnosis. Part of that is providing patient education on different medications. I am able to prescribe medications, and I can refer to specialists and other physicians that the patient may need to see. So from start to finish, if I'm seeing a patient as a PA, I go in the room, and I say, "Hi, I'm Michelle. I'm your PA. Can you tell me a little bit about why you're here today?" And I take a history. And then I come to a conclusion on what I think the diagnosis might be. And then I do a physical exam based on that. Then I will order tests to try and help me determine what the diagnosis is. I will interpret those tests and then devise a treatment plan to give to the patient. I'll prescribe medications if possible. I'll refer to specialists if needed, and I'll talk to my collaborating doctor if needed. Okay? So after 18 years in clinical practice, I am able to do this very independently. But obviously, early on in your career, you're going to be working more closely with the physician, right? So in general, from start to finish, that is what I can do with a patient. Now, beyond that, in terms of surgery and procedures, PAs can first assist in surgeries. We can suture, and we can really assist the physician in any surgery that they are doing. We can perform procedures like lumbar punctures, thoracentesis, where you're kind of draining fluid out of the lung, paracentesis, biopsies. We can do sutures. We can do adjustments based on if you have a dislocated shoulder and things like that. So PAs work in a variety of settings like orthopedics, ER, ICU, putting in central venous lines where a lot of procedures are required. So PAs can perform those procedures after they've been appropriately trained and signed off by the physician to be able to do those procedures on their own. So PAs can do a variety of procedures based on the specialty and the level of expertise and training that you have to do them after being signed off by your collaborating physician. So PAs can do a lot of interventions in that setting. Outside of the clinical practice, we help patients navigate the medical system. We also help our physicians in terms of, billing for visits and generating revenue for the practice. We also work with insurance companies when needed to order certain tests for patients. We really help the patient navigate how to work through each part of their journey as a patient, whether that means working with nurses and administrative staff to really make sure that the patient is getting the adequate treatment that they need. So in addition to the clinical duties, there is going to be those administrative sides, and I do have another video on this, on administrative tasks for PAs, but you can really get a sense of really helping the patient through the system. We do a lot of, follow-up care for patients and a lot of patient education to really ensure that the patient understands what treatment they're getting, why they're getting it, what the next steps are in their care, and be able to appropriately have a diagnosis and treatment and a positive outcome, because that's what we really want for all of our patients. Now, obviously, depending on your specialty, your role and your duties are going to be different. So as somebody that works as an outpatient clinic PA like I do, you are going to see a lot of patients during the day, are going to be in and out of rooms and, scheduling follow-up care and, writing prescriptions and seeing them and doing histories and physicals and all of those things. But if you are working in the hospital, that situation is going to look a little different, right? You're going to be rounding on patients. You're going to be rounding as a team. You're going to be working with the nurses to make sure they're getting their care. You're going to be working with specialty teams and collaborating with them. There is a lot of collaboration as a PA in terms of talking to other physicians, other specialists, other services, and really being able to coordinate care for patients. Care coordination is really important, particularly when you're working inside the hospital setting. You also get to do procedures inside the hospital setting as well. So if we're talking about what can a PA do, there's really a wide variety of services a PA can provide, starting with the basic, history and physical exam, but really ordering those diagnostic tests, interpreting the tests, writing prescriptions, devising a treatment plan, providing patient education, collaborating with other specialties and physicians, serving as a help in terms of navigating the healthcare system. PAs can really make an impact on the patient journey in that way. Now, depending on the state and the practice setting that you work in, the prescriptions and the amount of medications you can prescribe will be different. Laws for PAs in terms of prescriptive rights are slightly different from state to state, so it's really important to know what your state law allows for PAs and prescriptive authority. And any of your employers are going to help you through that process as well, but it's important for you to know that when you go get licensed in a state. PAs are nationally certified, but every state that we work in, we have to obtain a license. In part of that license is gaining prescriptive authority and a DEA license. And you will learn in what state you're able to prescribe what medication going through this process. So I hope this gave you a good overview of what PAs can do. Obviously, there's a wide variety of what we can do based on practice setting and scope of practice, as well as your specialty, but just for the gist of it, I hope this cleared that up for you, and now you can answer, what does a PA actually do?